You're scheduled for surgery next month. Your doctor says it's routine. Nothing to worry about, they tell you, but there's something they're not telling you. Something that happens to your brain during anesthesia after 60. Something that could steal your memory, your independence, your ability to recognize your own grandchildren. I'm Dr. David Chen, and what I'm about to reveal could save your mind. If you're over 60 and facing surgery, you're playing Russian roulette with your brain. Not because surgery is dangerous, but because of what anesthesia does to an aging brain. Here's what shocked me after 15 years as an anesthesiologist. Up to 40% of patients over 60 experience cognitive decline after surgery. That's nearly half. Some recover in weeks. Others never fully come back. They call it POCD, Post-Operative Cognitive Dysfunction, and almost nobody warns you about it. Now let me show you what's really happening inside your brain. After 60, your brain physically changes. Not because you're sick, but because it's normal aging. And these changes make anesthesia dangerous. First, brain shrinkage. Your brain loses 0.5% of its volume every year after 60. By 70, it's 5% smaller. By 80, it's 10% smaller. This isn't just size, it's function. Fewer neurons, fewer connections, less reserve capacity. Second, chemical shifts. Your brain produces fewer neurotransmitters, the chemicals that regulate consciousness, memory, and alertness, and the receptors that anesthetic drugs bind to become more sensitive. The same dose that's safe at 40 can be dangerous at 70. Third, the blood-brain barrier weakens. This protective barrier keeps toxins out of your brain. After 60, it becomes more permeable. Anesthetic drugs cross into brain tissue faster, penetrate deeper, and stay longer. The margin between enough anesthesia and too much anesthesia becomes razor thin after 60. Too little. You might wake up during surgery. Too much. Your brain gets suppressed so deeply it may not fully recover. We're walking a tightrope, and your brain is the safety net that's already frayed. Your liver and kidneys clear anesthetic drugs from your system. But after 60, liver function decreases 1% per year, and kidney function drops 1 to 2% per year. By 70, your kidneys might work at only 60% capacity. A 30-year-old clears half the drug in 40 minutes. A 70-year-old, 90 minutes or more. During long surgeries, repeated doses stack up. In younger patients, each dose is cleared before the next. In seniors, doses accumulate. What should be safe becomes an overdose. Even if you never smoked, even if you exercise, your lungs change after 60. Tissue becomes less elastic. Air sacs become less efficient. Breathing muscles weaken, and your brain's drive to breathe becomes less responsive. In younger people, when breathing slows, the body compensates automatically. Carbon dioxide builds up, the brain senses it, and the drive to breathe increases. After 60, this loop weakens. Your brain doesn't respond as aggressively. We suppress your breathing intentionally during surgery. We take over with a ventilator. That's expected. But when we try to wake you up, that's when the problem starts. Your weakened respiratory drive can't handle the transition. You don't breathe deeply enough or frequently enough. Oxygen drops. CO2 builds up. We have to support your breathing longer than planned, sometimes much longer. Anesthesia always lowers blood pressure. It relaxes blood vessels and reduces how hard your heart pumps. In young, healthy people, their cardiovascular system has reserve. It compensates. After 60, that reserve is gone. Arteries become stiff and less flexible. They can't dilate and constrict efficiently. Your heart muscle weakens slightly, pumps less forcefully, and the electrical system becomes less stable. When anesthesia drops your blood pressure, your body struggles to bring it back up, and your brain, kidneys, and heart all suffer when pressure stays low. This is why we see significantly higher rates of strokes during surgery, heart attacks post-operatively, and kidney injury from inadequate blood flow. The older you are, the higher the risk. This is what keeps me up at night, and it's what nobody warns you about. Up to 40% of patients over 60 experience cognitive impairment after surgery. It shows up as confusion, disorientation, memory problems, difficulty concentrating, and trouble with problem solving. For some, it lasts days or weeks, then resolves. For others, it persists for months, and in some cases, it never fully goes away. There's growing evidence that anesthesia in older adults may accelerate cognitive decline and may increase the risk of developing dementia later. We don't fully understand why, but the correlation is there, and it's concerning. Our current theories point to brain inflammation triggered by anesthesia and surgical stress, and to the effects of deep anesthetic suppression, what we call burst suppression, where brain activity becomes so suppressed it nearly flatlines. Patients who spend more time in this state have higher POCD rates. The older you are, the higher your risk. This is why modern anesthesia focuses on using the lightest level that keeps you safe. We monitor brain activity, avoid going deeper than necessary, and use shorter-acting drugs when possible. But we can't eliminate the risk entirely. Going into surgery after 60, there's a real chance you might not feel mentally sharp afterward. Maybe for a while, maybe for a long while. You deserve to know that. Everything so far has been about anesthesia working too well, going too deep and causing complications from oversuppression. But there's another danger: anesthesia failure. Remember, your brain chemistry changes after 60. In most older patients, receptors become more sensitive to anesthetic drugs. But in some, individual receptor systems become dysfunctional. They become less responsive. When that happens, normal doses don't work. The patient doesn't go fully unconscious, or they're unconscious but still have awareness, or their body responds to surgical stimulation. This creates a dangerous dilemma: give more and risk oversuppression, or accept a lighter state and risk awareness or inadequate pain control. Sometimes it's extreme resistance, requiring double the normal dose, but because the liver and kidneys clear it slowly, that massive dose stays in the system for hours. Breathing recovery is delayed. Blood pressure is unstable. What should have been routine becomes a prolonged, complicated emergence. This unpredictability is the real challenge of anesthesia after 60. We can't always predict how your individual brain will respond. Every case requires more caution, more monitoring, and more experience. Anesthesia is riskier for you than for younger patients. Not catastrophically riskier, but measurably, significantly riskier. Your chance of complications is higher. Your recovery might be slower. Your brain might not work quite right for a while. But here's the thing: we know this. We plan for it. We adjust. We monitor you more closely, use different drugs, lower doses, wake you up more gradually, and support you more aggressively in recovery. Modern anesthesiology has evolved specifically for aging populations. When done carefully by experienced practitioners, anesthesia after 60 is still safe, just different. Here are the 5 questions you must ask your anesthesiologist. 1. How will you adjust for my age? They should mention lower drug doses, brain monitoring, gradual emergence, and extended recovery support. 2. Will you use brain monitoring? Devices like BIS monitors track brain activity and help prevent going too deep. 3. What's your plan for emergence and recovery? They should explain how they'll wake you up, how they'll support breathing, and how long recovery typically takes. 4. What signs of cognitive dysfunction should I watch for? They should tell you what's normal versus concerning, and when to seek help. 5. What medications will you use? Shorter-acting drugs are better for seniors. They clear faster and cause less accumulation. Prepare your body in the weeks before surgery. Optimize your nutrition and ensure adequate B vitamins, especially B12. Stay hydrated. Get good sleep. Control blood sugar if you're diabetic. Manage blood pressure. Stop smoking immediately. Even a few weeks helps. Limit alcohol, as it affects how your body processes anesthesia drugs. After surgery, watch for warning signs. Mild confusion for 24 to 48 hours is normal. Severe confusion lasting more than 3 days is not. Fatigue for a week is normal. Inability to recognize family members is not. Mild memory lapses are normal. Complete disorientation or personality changes are not. If you notice concerning signs, contact your doctor immediately. Before surgery, review all medications with your anesthesiologist. Blood thinners, blood pressure meds, diabetes medications, supplements, everything. Some need to be stopped. Some need to be adjusted. Don't hide anything. And have someone with you for at least 48 hours after surgery. You may not remember instructions. You may not recognize problems. You need an advocate. Anesthesia after 60 is different. Your brain is different. Your body processes drugs differently. The risks are higher. But knowledge is power. When you know what to expect, you can prepare. When you ask the right questions, you get better care. When you choose experienced practitioners, you get safer outcomes. You're not powerless, you're informed, and that makes all the difference. Your action plan. Schedule a pre-op consultation with your anesthesiologist. Ask the 5 questions. Optimize your health in the weeks before surgery. Arrange for post-op support. Watch for warning signs of POCD, and be patient with your recovery. Your brain needs time to clear the drugs and heal. I'm Dr. David Chen. Stay informed, stay safe, and remember, knowledge is your best anesthesia.